in Korea. Today, we prepare the case of percutaneous pulmonary valve implantation. Before we start our case, I would like to introduce our staff, Dr. Zhang, Dr. Bang, and the nurse, Ms. Zhang. They will perform a percutaneous pulmonary valve implantation, and I will back up these guys.
Hello, everyone. I'm Dr. Jong-Yoon Kim, a pediatric cardiologist at Sejong General Hospital. It is an honor to introduce the case in this tape presentation of PPVI with the Pulsta valve. So I'll briefly introduce the patient history. The patient is a 25-year-old woman with the initial diagnosis of tetralogy of Fallot. She underwent TUAP repair using transannular approach at the age of 14 months. So she is near function class 2. There was no significant finding in her blood test. The X-ray shows mild cardiomegaly, as you can see. The EKG shows a heart rate of 77 BPM with a right bundle branch block pattern. And the QRS duration is 132 milliseconds. CPX shows VO2 max of 23.7, which was 64% of age predicted exercise capacity, indicating exercise intolerance. The echocardiography shows that severe pulmonary regurgitation with the RV ventricle enlargement, while ventricle function was preserved. The CT scan shows that, as you can see, good pulmonary biventricle pulmonary artery and are sizable without stenosis, and as you can see, coronary artery pattern is usual patterns. The narrowest section measured 19.4 millimeter in AP view, and in a lateral view with a 22.2 millimeter in lateral view. And distal MPA measuring 27.6 and 25.7 millimeter respectively. The cardiac MRI also shows that severe pulmonary regurgitation, so PR fraction of 37%, this indicating severe pulmonary regurgitation, and RV and diastolic volume index 153, which demonstrates significant right ventricle enlargement. Based on these findings, we decided to proceed PPVI using Pulsta valve. Thank you for listening.
Actually, we have already finished the hemodynamic study and the RV angiogram and the balance sizing. So the RV pressure was 34 and the main pulmonary pressure is 25. So only 9 millimeter mercury pressure gradient on the pulmonary valve level. And the patient showed the severe PR as Dr. Kim presented. The right ventricular volume index more than 150. So this patient is indicated for the pulmonary valve implantation. So today we will use the Pulsta valve. It's the self-expanding pulmonary valve. And on the right ventricular angiogram, as you can see on the fluoroscopy image, on AP view, cranial view, the distal part of the main pulmonary artery was 27.5 millimeter, and the narrowest diameter was nearly 16 millimeter, and below the valve level is more than 20 millimeter. Okay, this is the lateral view. Distal part of the main PA was 28, and the middle portion is 23 millimeter, and the valve level is 15 millimeter, and below the valve level is 28. And we tried the balloon sizing with the sizing balloon. Next, cranial angle, the distal part is 29, and the narrowest portion is 22, and the lower portion is 28. So, and on the lateral, Also, the distal part is 29 near 30, and the narrowest is 22, and below the valve level is nearly 30 millimeter. Hi, everyone.
아이고, sorry. Wait. I'm sorry. No.
Hi, everyone.
Yeah, on the angio, the narrowest diameter was 16, and on the lateral, similar, but the balloon sizing, it was 22. On the distal part is 20, almost 30. Yeah. In this case, okay.
Today we will
이거 stop.
choose the Pulsta valve 20.
이게 꺼지네. Sorry. No. 포즈 하는 게 없어요? 포즈. 이게 항상 도중에. 포즈 거기서 할 수 있고 여기서는 포즈 못해?
More than
So there are several doctors who experienced the Pulsta valve implantation. So what size of the Pulsta valve you can choose? The panelist can answer. Okay, Jeong Choi.
In this patient, I'm going to use a 28 millimeter. I'm going to oversize and use the 28 millimeter because
Okay. On the CT it was 16, but the balloon sizing narrowest diameter 22.
Yeah, the
and the
balloon
distal part
sizing-
is 30.
yeah, you use the compliant balloon, the A sizing balloon. I think with some, if you use a tie-shack balloon, then it may be go up to maybe 24.5. I think so. So I'm going to use 28 millimeter.
Okay. Dr. Wang?
Because the distal and proximal part, there is some quite a wide range of
Yeah.
flaring. So it's maybe some opposition to the larger valve may better opposed to the walls. That's the worst.
Dr. Wang?
So in my opinion, I think 26 by 38 will be okay.
26?
By 38.
Okay. 또 그러네. Okay. It's a lump.
narrowest portion is 22, and the low portion is 28. So, and on the lateral, also the distal part is 29 near 30, and the narrowest is 22, and below the valve level is nearly 30 millimeter. So the narrow portion is 22, so we usually choose 2 or 3 meter larger valve, but the distal portion is already around 30 millimeter. So today we will choose the Pulsta valve 28 millimeter. Pulsta valve we will use.
Yes, the coronary compression test is okay, not compressed by a balloon.
Fixed with the greater iodide solution. This is a Pulsta valve. Diameter was 28 millimeter, and the length is 38 millimeter. This is a nitinol wire mesh. It's not a laser cut nitinol, so it's resistant for the fracture, just like a frame mesh work, like this. Yeah, wire mesh. So it's very resistant for fracture. And This is a valve made from the porcine pericardium and especially treated for the longevity. It was fixed with the glyceride, so we wash out the glyceride in a.
Okay.
Seong-Ho, I had a question. When I saw your coronary interrogation, you did it with a compliant balloon. So how does it serve the purpose? I mean, the waste on the balloon is still there. Why not use a non-compliant balloon for both, for confirming what the RVOT diameter is and for even testing the coronaries? Because you won't leave that waste on your valve. You are going to get rid of that waste. So my question is, how does it help
We
doing it?
usually use the sizing balloon or in the air. Sometimes we use the non-compliant balloon, but as you can see, the diameter is increased when the balloon is. So I usually prefer to use the non-compliant balloon because well matched with the RVOT shape. And if the Pulsta valve implanted, it can enlarge the same size of the narrowest diameter.
Okay.
So I prefer to use the
Thank you.
compliant balloon. Okay. Good question. And as you can see, this Pulsta valve is nitinol meshwork, so the very resistant for fracture. Joko Wang, you have experienced the Pulsta valve and the venous valve. Compared to that, what is the advantage of this Pulsta valve?
Our experience of Pulsta valve, they're never fracture, but we have one venous P valve fracture. However, the function still remains intact. Yeah. So Pulsta valve is, I admit, it's softer and easy to negotiate with RVOT.
Yeah. So one advantage is resistant for fracture, and also the length of the whole diameter, the valve is only 38.
Yeah, right.
So the venous P valve is
Longer.
more than 50, right? So it usually did not touch the right ventral outflow tract. The PVC rate is very low.
Yeah.
And also when you insert the valve on the RVOT position, the trackability is very nice, so easy to go to the proper position. There's so many advantages. Okay, keep on.
2 minutes each bottle. Before we load the device, I would like to introduce you our delivery system. This is a rotating knob here. When we rotate it clockwise, the distal part is open like this. So we can open more than half of the pulmonary Pulsta valve like this. After then, we slide. This is a sliding knob, and we can open it finally. So the valve was opened finally. So 2 knob is here to open. Okay. I would like to show you a valve motion like this. Close, open, close. It's the distal portion and the proximal portion, and it's a loading. I'd like to show you. Insert the valve into the clamper. Okay. Then distal part of the delivery system is go into the valve. Okay. And as you can see, there is a hook. The last portion of the wire mesh was hooked over there. Proximal part of the valve was inside the delivery system. Yeah, declamping.
The loading time is
And as
very
you can
short
see,
compared to the
Pulsta valve is well loaded here. And you can see the hook. The very proximal portion was hooked well. Here. Okay. Flush to the air, this portion. Okay, good. And also the flushing the flush. Okay, good.
And this delivery
Now
system
we
is low
introduce
profile,
the delivery
20
system
frames.
to the via the right femoral vein. Okay. Good. As you can see, on the fluoroscopy, the assembled part is well advanced. It's very easy to and we usually open the distal part on the right pulmonary artery proximal part using a rotating knob. As you can see, the operator, Dr. Zhang, is now open the distal part by clockwise rotating the knob like that. And as you can see, the distal part is open. Now we pull back the holder system to the main pulmonary artery. 조금 더 가야 돼. 탁 오픈되는 거 보고. Okay. As you can see, the distal part is roughly enlarged the size. It means that it came from the RPA to the MPA. So we are now checking an angiogram over there. Okay. Okay. Good. It's well positioned, I think so. How about? So then we open the distal part now using a sliding knob. Okay. Good. It's well open. Then the hook is now on the pulmonary valve, Pulsta valve. So in this case, we wait several seconds and automatically, okay, like this. Then, okay. We remove this part with the carrot, remove her back. Good. In our hospital, we use the vessel navigator, which is fusion imaging of cardiac CT and the fluoroscopy. As you can see in this screen, the yellow colored one is 3D reconstructed heart using a CT. And we put it onto the fluoroscopy. And then when we move the camera angle, this image is automatically follow that. So it's very good for positioning the Pulsta valve in or any other kinds of interventional procedure. As you can see, the Pulsta valve is well positioned in the pulmonary portion, okay? Okay, after successful implantation of pulmonary valve, we insert the pigtail catheter to the distal MPA and also onto the right ventricle, and we simultaneously measure the pressure. So MPA pressure was now 23, and the right ventricular systolic pressure is 26. So the gradient was only 3. So it's much better than before the implantation. And we will check the MPA angiogram to whether there is still pulmonary regurgitation or not. Okay, angio. Okay, great. As you can see, the MPA angiogram shows no regurgitation on the pulmonary valve level. So the pulmonary valve of the Pulsta valve is working very well. Okay. RV angio shows the good forward flow to the pulmonary artery. So it means the valve is working very well. Okay, finally, we successfully implanted the Pulsta valve on the proper position. Congratulations on your great successful procedure. Dr. Zhang, Dr. Bang, great person. Okay, we are very happy to show your successful percutaneous pulmonary valve implantation using a Pulsta valve today. Thank you for your attention. Bye-bye.